Get with the Guidelines Resuscitation is the premier quality improvement program for more than 300 hospitals across the country. It collects data from the hospitals about how patients who suffer cardiac arrest are resuscitated and whether they get with the guidelines. But most importantly, it tracks the variability in practice that impacts survival and good neurologic survival after cardiac arrest. The future for Get with the Guidelines Resuscitation is bright. In 2000, the American Heart Association started collecting information from more than 300 hospitals in a program that was called the American Heart Association National Registry for CPR. In 2010, that then transitioned into the Get with the Guidelines Resuscitation as part of the suite of programs that's helping hospitals meet accreditation and quality improvement goals across the nation. We started with just following cardiac arrest and then incrementally added in the present medical emergency team response and before arrest, and also a post-cardiac arrest component that now tracks patients throughout all phases of resuscitation. In the future, we're going to be adding real quality pieces that allow hospitals to really gauge their performance, decrease variability, meet accreditation guidelines, and they'll even offer awards that will allow people to know, allow the hospitals to know their progress along that line, going for the gold as they move towards improving survival outcomes from cardiac arrest. Participation in Get with the Guidelines Resuscitation means a lot to each hospital that participates for their own quality improvement for infants, children, adolescents, and adults through the whole spectrum of care from before the resuscitation, medical emergency teams, during the cardiac arrest, cardiopulmonary arrest, and following cardiac arrest with a post-cardiac arrest care module. By collecting that data, they can figure out the who, what, where, why, and when of resuscitation in their hospital, and then benchmark and compare it to other hospitals that have similar severity of illness and similar configurations to their own hospital. Through that process, they can help each other improve the care for those patients that suffer cardiac arrest. And because more than 200,000 patients arrest in hospital every year, that's a lot of patients and a lot of things that can be improved. Get with the Guidelines Resuscitation has a research component for neonates, infants, children, adults, and all through the spectrum. And this research is really changing the way we resuscitate patients from cardiac arrest. The data registry provides quality improvement information back to the hospitals immediately, but that information is pooled over the last 10 years, and the trends in management and how getting with the guidelines impacts outcome is tracked and analyzed, and then published by peer-reviewed publication, and those publications change the AHA guidelines for cardiopulmonary arrest care across the nation and across the world. Quality of care has many meanings. For the hospital itself, it's that they're doing the best job they can to get with the guidelines and save patients' lives. For the individual patient, whether they're an infant, child, adolescent, or adult, it means that they're receiving the best care, that they're receiving care that complies with the best guidelines, and it's implemented by the teams in the hospital to get the best outcome they can be. We know that survival after cardiac arrest is not 100%, and it probably never will be, but we know that there are some very simple things pre-arrest, during arrest, and after arrest that can be done to maximize the chance of a good survival. Get with the Guidelines Resuscitation ensures that each hospital and each patient knows what that is, knows how they're doing, and knows what they need to do to get the best care for that patient.